Radioactive Cancer Treatments by Hunter Miller. The history of the technology. The history of radioactivity in cancer treatments can be traced back to the late 19th and early 20th centuries. In 1896, French physicist Henri Becquerel discovered radioactivity while studying uranium salts. Marie and Pierre Curie furthered this research and isolated radium and polonium, demonstrating their radioactive properties. The medical applications of radioactivity began in the early 20th century when radium was first used to treat cancer. In 1903, Marie Curie won the Nobel Prize in Physics for her groundbreaking work and the use of radioactive substances in cancer therapy, gaining momentum. Over the years, advancements in technology and understanding of radiation's effects on cancer cells led to the development of sophisticated radiotherapy techniques, revolutionizing cancer treatment and significantly improving patient outcomes involved. The scientists crucial to the development of radioactivity in cancer treatments include Marie Curie, Pierre Curie, and Henri Becquerel. Marie and Pierre Curie's groundbreaking research in the early 20th century involved the isolation of radium and polonium, opening new avenues for medical applications. Henri Becquerel's initial discovery of radioactivity in uranium salts provided the foundational knowledge for their work. Together, these scientists played pivotal roles in establishing the groundwork for the application of radioactivity in the field of cancer treatment, ultimately revolutionizing medical science. The type of radiation have a relatively low penetration ability, making them suitable in the context of radioactivity in cancer treatments. Various types of radiation, high energy electrons, including alpha, beta, and gamma radiation, have intermediate alpha particles consist of 2 protons and are often used in treating surface tumors. Gamma radiation, composed of electromagnetic waves, possesses high penetration capacity, allowing it to reach deep-seated tumors and making it a key component in external beam radiation therapy for cancer. The selection of the appropriate type of radiation depends on the specific characteristics and location of the cancer being treated. The balanced nuclear equation. The balanced nuclear equation for cancer treatments can vary depending on the specific radioisotope used and the type of treatment. One common example involves the use of cobalt-60 in radiation therapy machines known as cobalt units. Cobalt-60 undergoes radioactive decay by emitting gamma rays, which are used to target and destroy cancer cells. The decay process is represented by the following balanced nuclear equation. The main isotopes used in cancer treatments. Several isotopes are used in radioactive cancer treatments, each selected based on its specific characteristics and the type of cancer being treated. Some commonly used isotopes include iodine-131, used in the treatment of thyroid cancer. Iodine-131 is absorbed by the thyroid gland and emits beta particles, damaging nearby cancer cells. Cobalt-60, employed in radiation therapy machines. Cobalt-60 emits gamma rays that target and destroy cancer cells. Strontium-89 and samarium-153, these isotopes are used to relieve pain in patients with bone metastases from certain types of cancer. They emit beta particles that target the bone metastases. Yttrium-90, used in targeted radiation therapy. Yttrium-90 is often bound to compounds that selectively accumulate in tumors, delivering a localized beta radiation. Phosphorus-32, employed in the treatment of certain blood disorders and leukemia. Phosphorus-32 emits beta particles to target and destroy rapidly dividing cells. These isotopes and their respective decay properties are carefully selected based on the specific characteristics of the cancer and treatment goals. The choice of isotope depends on factors such as the type and location of the cancer, the depth of the tumor, and the desired therapeutic outcome. The number of protons and neutrons in that isotope. Here are the numbers of protons and neutrons for the mentioned isotopes commonly used in radioactive cancer treatments. Iodine-131, protons 53, neutrons 78. cobalt 60, protons 27, neutrons 33. Strontium 89, protons 38, neutrons 51. Samarium 153, protons 62, neutrons 91. Yttrium 90, protons 39, neutrons 51. Phosphorus 32, protons 15, neutrons 17. These numbers represent the atomic structure of each isotope, where the sum of protons and neutrons gives the mass number. These isotopes are chosen for their specific radioactive properties that make them suitable for various cancer treatment applications. The safety concerns. Radioactive cancer treatments pose safety concerns primarily related to radiation exposure. Medical personnel working with radioactive materials need to minimize exposure through protective measures, such as shielding and maintaining a safe distance from radiation sources. Patient safety is a crucial consideration, with careful administration and monitoring of radioactive substances to avoid unnecessary exposure. Additionally, proper disposal of radioactive waste is essential to prevent environmental contamination and potential harm to individuals who might come into contact with the materials after treatment. Pros and cons of continuing to use the technology. Continuing to use radioactive cancer treatments offers significant benefits, including their effectiveness in targeting and destroying cancer cells, particularly in localized or metastatic conditions. Radioactive treatments can be a crucial component of comprehensive cancer care, providing options for therapy when surgery or other treatments may not be feasible. However, drawbacks include potential side effects from radiation exposure, such as damage to healthy tissues surrounding the tumor. Additionally, there are logistical challenges in handling and disposing of radioactive materials, and the long-term impact of radiation on patients' health remains an area of ongoing research and consideration. Impact on community from continued use. The continued use of radioactive cancer treatments has both positive and negative effects on the community. On the positive side, these treatments can contribute to improved cancer outcomes, potentially reducing mortality rates and enhancing overall community health. However, concerns about radiation safety may lead to anxiety and fear among community members, necessitating comprehensive education and awareness programs. Additionally, the proper management of radioactive waste and the potential environmental impact could affect the community's perception of the safety of such treatments, requiring transparent communication and adherence to stringent safety protocols. And here's my works cited page.